Today I'd like to talk about revision rhinoplasty, specifically whether using rib cartilage is absolutely necessary for revision rhinoplasty. These days there are a lot of people coming in for consultations about revision rhinoplasty, but I've noticed that so many people come in thinking that rib cartilage must always be used when having revision rhinoplasty. Recently using rib cartilage has become somewhat of a trend, but even so there are still people who think that revision surgery absolutely requires rib cartilage. I made this video today to explain that this isn't necessarily the case. So first of all, when it comes to nose surgery, it can generally be divided into the bridge and the tip of the nose. But usually whether it's autologous rib cartilage or donated rib cartilage, this material is typically used for the tip of the nose rather than the bridge. So when you look at the nose from below and see the nostrils, this type of rib cartilage is usually used to build a support column between them. First of all, the bridge of the nose. In many cases of revision surgery aimed at solving those problems, this kind of rib cartilage is often not needed at all. For example, if you want to raise or lower the height a bit, this can be done by adjusting the height of the silicone or other materials, so it obviously has nothing to do with the tip of the nose. Next, if the silicone appears bent or off-center. This too can be resolved to some extent with a bridge surgery. Of course, if it's connected to the tip of the nose, you may need to address both together. That's fine as well, and the same goes for cases where the bridge of the nose is uneven or bumpy. So if you end up getting a revision rhinoplasty due to various issues related to the nasal bridge, then using rib cartilage doesn't really have much significance in these cases. With this in mind these days, it's not always necessary to redo the entire nose during a revision surgery. You can simply focus on the specific points you want to correct and have surgery accordingly. You don't necessarily have to completely redo everything. Now, moving on to the tip of the nose, the issues can be a bit different, but even so, these days, many people come in with very specific points they want to address regarding the tip of their nose. For example, if you want to make a slight correction to the tip, for example, you might want to slightly adjust the tip, or maybe the cartilage at the tip is visible, or the tip is too high, or perhaps it's too low. These are all possible concerns. Sometimes the position of the ear cartilage placed at the tip is a bit off, and people come in for these reasons. In some of these cases, you may need to use a support column. For instance, if the tip is very crooked, or if it needs to be raised significantly, or if the angle is too droopy and needs to be properly lifted, then using rib cartilage is of course necessary in such situations. There are cases where just slightly raising the height of the nasal tip is enough. For example, by placing ear cartilage or some tissue on top, what we call layered grafting, we can increase the height that way. In such cases, there's really no need to use a full support column. The same goes for cartilage show-through as well. You can harvest dermis or use donated dermis to cover the nasal tip or tidy up the part that looks like it's sticking out. Either approach works. And recently, there was a case where the cartilage at the tip of the nose had sagged a bit, making the tip look droopy. In such cases, you just need to slightly lift the cartilage. So in these cases, it's actually not absolutely necessary to use rib cartilage. And if you force yourself to use it when it's not needed, the scope of the surgery becomes larger. The recovery period also becomes that much longer. So I think it's best to get an accurate diagnosis of your specific situation and undergo surgery in a way that's most appropriate, allows for the fastest recovery, and minimizes the scope of the procedure. When you get nose surgery, you usually consult with several clinics, but in my opinion, it's best to have the procedure at a hospital that can properly and accurately diagnose your condition, which is why I wanted to share this today. In conclusion, rib cartilage is not always necessary for revision rhinoplasty. With that, I'll wrap up today's video. Thank you.